Hello everybody, my name is Dr. Carlos Petta. I am from Brazil and now we are at the São Paulo joint meeting of ISGE and the Brazilian Society of Endometriosis. And we have two doctors here, Dr. Diaz from São Paulo and Dr. Sabino from Porto Alegre. It's in the south of the country, and we are going now to discuss infertility and endometriosis. Dr. Sabino, what's the relationship about endometriosis and infertility?
Hi. Endometriosis is associated with infertility. 30% of patients with infertility have some kind of endometriosis. On the other hand, patients with endometriosis have an increased prevalence of infertility or subfertility. Patients without endometriosis will have 20-25% of fertility by month, and patients with endometriosis will be pregnant in 2 or 4% per month. So it's a very close relationship between endometriosis and infertility or subfertility.
Dr. Diaz, all women with endometriosis have infertility. How much time would you wait before indicating a surgical treatment for this probable or possible endometriosis?
Hi everybody, Carlos. Actually, we know that those women are trying to conceive for at least 1 year when they are in front of us. And what, in our opinion, is the most important thing is thinking about the infertile patients, if she has or not pain. And for us, the symptoms of pain are very, very important on the time and when we are going to perform a laparoscopy.
We know that one of the big problems and the relationship of the results of treatment infertility is age. How do you manage this patient based on age? It means, when do you indicate a surgery, when do you indicate a reproductive techniques to improve fertility based on age?
Usually you should see as a patient and as a couple. So you have to do the correct diagnosis of infertility, what is causing infertility in these patients with endometriosis, to perform some kind of investigation in husband's sperm. And we have some results in patients with more or less than 35 years old. So in patients with more older than 35 years old, it's much difficult, it's very hard to be pregnant compared to patients younger. So you can cut off 35 years old as a clear kind of cut off to do some progressive or some more aggressive treatment.
João, after you have made surgery and you have a patient below 35 years old and you are happy with your surgical procedure, what are the next steps for these patients to get pregnant? How much time do you wait until you try any technique of assisted reproduction?
Well, if we have a gold surgery, it means that we have fixed everything on the pelvis of the patients. We can wait, if he is under 35, for up to 6 months until we can move to another kind of treatment. It means that if the patient is okay and her husband also have semen analysis that's nice, we can wait until 6 months to that.
Sabino, what do you feel about repetitive surgeries for endometriosis? Do you think they can enhance fertility after you had tried once?
No, I think that's a good A good treatment for endometriosis, it's a one surgery based treatment. So the first surgery is the most important step in the treatment of this kind of patient. We have to do our part to control or to treat the disease in the first surgery, and after that we can do something to improve the pregnancy rate of this group of patients, doing some ovarian stimulation or even doing some kind of IRT treatment.
Dr. Diaz, what's your workup with the patient that you suspect of endometriosis? Do you think that we still have places for the diagnostic laparoscopy, or how do you prepare yourself to go to your surgical procedure?
We are lucky here in São Paulo. Nowadays, we think that the diagnostic laparoscopy is a procedure that have not an indication anymore. We can clearly know concerning the symptoms, concerning the medical examination, and mainly with images like transvaginal ultrasound or MRI or an echoendoscopy to properly diagnose where is the disease. And now we can be preparing our team with a coloproctologic surgeon or an urologic surgeon to perform the best treatment for our patients.
Well, we have seen the importance of having an adequate workup with these patients before indicating a surgery, to have a semen analysis, to have some hormonal assays, and after that to have a very well established protocols. So it's very important not to lose time. Losing time means increasing in age and decreasing fertility. I would like to thank Dr. João Diaz and Dr. Sabino for their presence here.